Hello and welcome to everyone joining us on our webinar, or actually it's a webinar, but it's a straight Q&A session with Dr. Adil Sheraz once again. So really nice to see you again, Adil. Thanks for joining us.
No, thank you so much for having me once again. Always lovely talking to you.
And, you know, it's our second acne one, and I think it's because acne it's one of those really popular ones, but people don't talk about it very much, do they?
I think you're right. It's such a common condition. I mean, whether you have 1 spot, 2 spots, 10, or whether it's severe disease, everybody at some point gets acne. So the question is, when do you call it a disease? And it varies with patients. Some people will not be able to tolerate having a couple of spots, and others go on living with 50 or 100, and that's normal for them. So I think you're right, it's such a common condition, and some people may think there's nothing we can do about it. It's part of growing older, it's part of puberty. So I often get parents coming in with their children, their teenagers in clinic, and most of the time the belief is that this is teenage acne. And it'll probably go, won't it, doctor? Do we have to treat it? Can we just leave it? And it's usually the child that's dragged in the parent to come and see me. But I think the feeling is that most of the times it will go. And maybe, yes, maybe a lot of the times it will just clear up. But the question is, what will it leave in its wake? And will you be left with pigmentation and scars for the rest of your life?
And I think also one of the things that I wanted to talk about, and I don't think we've got any questions on it, is the mental health aspect of it. And I think as an adult you can quite underplay how detrimental it is for your teenagers to be going through this.
Yeah, absolutely. I think there's a huge psychological burden with regards to acne. I saw a patient a couple of weeks ago who was in a way thanking the pandemic because he was able to wear a mask to school and he could just cover up his face because he had such severe acne. And it just goes to show, prior to people wearing masks and being able to cover up, they would have to be in social environments, in school, with friends. And it is very embarrassing for a lot of young men and young women, teenagers in particular. Huge psychological burden, depression, anxiety, not leaving the house, social isolation. All of these features go hand in hand with acne, as they do with a lot of skin conditions, which is often overlooked.
Exactly. And it doesn't really matter what the skin condition is. It's the effect of you don't look beautiful, normal, or whatever you might want to term it, which is the problem.
Absolutely, yeah. And I'm not sure whether social media, Instagram, TikTok, these things always portray a perfect image usually of the people that you're sort of viewing, and everybody is trying to be this perfect person as a whole in terms of skin, lifestyle, everything. So I think that adds to the pressure as well, and I think young kids now have it a lot harder than maybe I did when I was a teenager.
And I think you're constantly reminded, if you're having a photograph taken, and if the light is bad, you're constantly reminded of what you look like and all of things, isn't it?
And there's a lot more photographs taken now with phones. It's all the time. People take a picture of you without you even realizing it. So yeah, absolutely.
Yeah, totally. So I'm going to kick off with the questions that we've received in already. If you've got any questions as we go along, please put them in the Q&A session. But before we start, I've forgotten exactly what I said I wasn't going to forget, was to mention that about the British Skin Foundation, who are very kindly sponsoring this event, because Adil works very closely with the British Skin Foundation and is representing them now. The British Skin Foundation are as I believe, the only research-focused charity across all skin conditions. I think I've got that right. But you need to go and have a look at their website, because I was just saying before we joined with Adil is that our webinars are actually on the British Skin Foundation website as well, and it is just full of so much great information. And it's totally, I think what's so nice about the British Skin Foundation is that they cover every skin conditions. So you're not just biased to one, because there is that also, that wrap over was actually, well, what skin condition do I have? Is it rosacea, or actually is it acne? Because those two can be very similar as well, can't they?
Yeah, absolutely.
So yeah, so please, so a big shout out and thank you to the British Skin Foundation. As usual, you know, we work with them all the time. We do online clinics, so we're really, really well supported with all the dermatologists that we work with, which is great. So I'll kick on now, and I've already told Adil that some people have mentioned some prescription product. I think they're prescription products. I obviously am going to have a real problem trying to tell you what they are, but hopefully you can guess what they are, because my pronunciation is rubbish. And obviously we're not promoting these products in any way. They're just questions that have come in generally. So first of all, 8 years ago at 21, I was prescribed Roaccutane for a year, was fine for years after, but now at 29, acne is back worse than ever. No help from my GP. I'm in Belfast and I don't know what to do next. Tried all kinds of skincare, nothing works.
Okay, right. If you've had a good response to Roaccutane in the past, and if you didn't have many side effects and tolerated it well, then it sounds like that you probably just need to go on another course of Roaccutane. And that means getting a referral to a dermatologist, which your GP should be able to do. If you don't want to go on another course of Roaccutane, then occasionally repeat courses of oral antibiotics may be useful. But it sounds like if your acne is as bad as what it was originally and Roaccutane worked, then that's probably your best bet. Go back on the Roaccutane, do another 6 month, 8 month, or whatever course is necessary for you, and hopefully that should clear it. There always is a small chance of relapse with Roaccutane, and we always tell our patients that, but it is still the best drug for acne, and you probably want to get onto it quicker rather than later. We often find the longer you leave acne lingering around, it does become a little bit trickier to treat. Right,
and so that's fine to basically not go on and off it willy-nilly, but actually to go on it. And it's good that you have to go to your dermatologist to...
Yes, so your GP won't be able to prescribe it because it's a dermatology-only drug, so your GP will have to refer you into a dermatologist, and I don't know what the waiting times are like in Belfast, but it can be a bit of a wait. But if you have moderate severe acne with lots of inflamed spots or red spots with scarring, then hopefully you might be able to be pushed through. But I guess you just need to see your GP and see what they say.
And if that GP, I mean, we always say to people, if you're getting no luck with that GP, change your GP.
Yeah, I mean, if your acne is bothering you to such a degree where it's impacting your life, then that is enough for you to be able to see a dermatologist for the best possible treatment.
Good. So the next question: long-term mild acne, very oily skin, inflammation, excessive clogged skin, high dead, flaky skin, turnover. I presume that they're asking, this is what I'm presenting with, what should I do?
Okay, I guess a little bit tricky, obviously, without seeing images and working out exactly what's going on. So a couple of things come to mind. Number one is, if you've got lots of oily skin and you've got flaky skin, then do you have a condition called seborrheic dermatitis? Seborrheic dermatitis is a condition whereby increased oil production leads to increased yeast growth on the skin, which then results in dryness and scaling. And usually you will see the dryness and scaling in areas of high oil production. So it tends to be around the nose, around this area. Some people get it along the jawline. You might have it on the chest or the back. So these are typical areas. Ears and scalp as well can be affected. The typical areas where you might see the scaling and dryness. Now, if you've got all the pores that are becoming clogged, then there may also be blockages of these pores, because again, usually because of the excessive oil production. With regards to the seborrheic dermatitis, if it is seborrheic dermatitis, you can just use ketoconazole, which you can buy over the counter. It comes as a shampoo or creams, and you can use that, and that tends to help seborrheic dermatitis. If, however, this is acne with increased oil production, then you will need something like benzoyl peroxide, which you can buy over the counter, but that can be quite irritant, and you really have to use it slowly, gradually, get used to what you're using. So don't use it daily to start with. Use it maybe every third day, then every other day, and then daily. So gradually build up the use. Or if that doesn't work, it'll have to be something stronger, a prescription strength treatment that might contain adapalene or a tretinoin or a retinol. And again, your GP or your dermatologist may be able to prescribe that for you.
And generally, is it better to start off, if it's not hugely bad, is it better to start off with over-the-counter products, gentler ones, before you then try the sort of hard stuff?
I think if you've got acne and your diagnosis is confirmed, or you're pretty certain it's acne, then yeah, you could start off with over-the-counter benzoyl peroxide, which is a very good drug and it works reasonably well. You can also buy lots of salicylic acid washes and topical products over the counter, and it's a good idea to start off with those first and see how you get along. And if they don't work, then you see a dermatologist and we can up titrate the treatments.
Or maybe try and book with your dermatologist, and then a year later we'll have how long it might take to see them. Something awful, sadly. What is the best way to get rid of acne pitting? Someone told me that filler was a good option.
Okay. When people get, so pitted scars are scars that are often the result of quite inflamed acne that you've had in the past. So you might have had really red, painful, inflamed spots. When they clear, they result in destruction of part of the skin and what's underneath it, and you get pitted scars, which are essentially indentations into the skin. So they look like dents in the skin. They are very tricky to treat, and often as dermatologists, we end up using a variety of different modalities to treat pitted scars. So you might, for example, have lasers. You might have topical peels. You might also have a surgical treatment whereby you cut actually into the scar, because often scars are tethered down and they pull down. So you need to release the base and it often plumps it up a little bit. So a combination treatment. Now, fillers, I find, probably are not the best option for pitted scars because they will most likely just accentuate it. So they'll fill the area around it, but the scar itself will remain the way it is. So I don't think that's the best option. You probably want to see a dermatologist and discuss other treatment options before you consider anything like a filler, which I don't think works very well for pitted scars.
Okay. Yes, and I suppose it really depends where you get your advice from as to whether filler is the option or not.
Yeah, I think a lot of dermatologists will have their own specialties. Some dermatologists will be more up on their laser treatment. Some will be more topical treatment. So whoever you see will sort of plug what they do more because they're more experienced in that. So you probably want to see a dermatologist maybe who deals with acne and the repercussions of acne and scarring, and maybe they'll be able to give you more balanced advice.
And when you have these sorts of treatments that you're talking about, I mean, it sounds really daft. Is it under local anaesthetic, or are you put to sleep, or?
Almost always under local anaesthetic, particularly the surgical ones. Lasers, you don't need anaesthetic. Sometimes you get a topical one, which you might get in depending which clinic and what type of laser you're having. But yes, it's almost always a day procedure, often over and done within an hour or so.
Okay, and are they often those procedures you come back a few weeks later for another one, or is it a one-off?
So depending on what you have, so if you have the surgical treatment, which is the subcision, then often that can be long lasting. But if you have lasers, and some people do need top-up treatments to come back again, microneedling, for example, which works reasonably okay, not amazing, but it does have some impact, you will need top-ups for those. So every 4 to 6 months, you might need a repeat session. So it's just like any skincare routine you'd be doing, which you would need to do regularly to have benefit. You may need to be doing the cosmetic treatments regularly to have benefit.
Okay. My 18-year-old skin goes well, then suddenly very angry red spots with heads appear. Help.
Okay, so it sounds like you've got inflammatory acne. Now, inflammatory acne basically means that you've got your basic acne, which is closed or open comedones. The comedones are pores, and if they become blocked, they may become closed. If they're open, they become blackheads. And if you get increased amounts of bacteria within that pore, then you will end up having inflammatory acne, which is where you get the red, painful spots. And that's usually because of bacterial overload. The bacteria is called Cutibacterium acnes, which lives in our skin. If you have inflammatory acne, then usually you'll need some form of antibiotic to counteract that the bacteria, and that can often be topical. So there are topical antibiotics that your GP can prescribe you. You also will need something keratolytic, which basically means you want to get rid of the dead debris on the surface, which is also part of acne. So you want to get rid of that, and something like benzoyl peroxide works reasonably well for that. It also has some antibacterial effect as well. And then you may well need an oral antibiotic, which your GP will have to give you.
Gosh, quite a lot then, isn't there?
Combination treatments. You must, so whenever you have any type of acne, if you are giving a patient an antibiotic, you should always try and give them benzoyl peroxide with it. And the reason is because a lot of the studies have shown that if you use benzoyl peroxide with an oral antibiotic, there's less chance of you developing resistance to the antibiotic.
Oh, right. Oh, that's really important then, isn't it?
Yeah, so it's important to use benzoyl peroxide with the antibiotic. And benzoyl peroxide, people often give up on it because it's irritant. So as I said before, build it up slowly. You don't need to do it every single day if it's irritating your skin. Just really slowly build it up, and you should get used to it.
Okay, cool. I think we might have answered this. This is another one. So what's the best treatment for reducing acne scarring? Is that similar to what we've just discussed, or is it slightly different to the pitting?
No, I guess it depends on the type of scar you've got. So acne will cause lots of different types of scars. You will have pitting scars, you have box scars, which look like sort of wider indented areas. Then you have rolling scars where people have some sort of uneven surface of the skin. They're called rolling scars. So the different types of scars will need different types of treatment. Now, doing this for years, what I've noticed actually is that what people think are scars are usually not scars, and what they're referring to is pigmentation. Right. So if you have dark spots on your face because of the acne, then that is usually hyperpigmentation, which is a result of the acne. And hyperpigmentation is treated very differently to scars. So hyperpigmentation generally will settle. It may take 18 months to settle, but there are other treatments you have available to speed up the clearance of hyperpigmentation. So topical tretinoins, a variety of over-the-counter products will do it. The alpha hydroxy acids, glycolic acid, or peels, or lactic acid peels will help. So there's lots of things you can do to treat hyperpigmentation. And as I said, I find people often mistake that for scarring, which is what they come in for, because they think that's scarring, but that is not scarring. That can be dealt with. Scarring by definition is permanent, because scarring is a scar, you've got it for life. And a lot of the treatments you'll have for scarring will only minimize it. It won't necessarily clear it completely. It will minimize the scarring or make it blend in a little bit better with your skin.
Okay. But this is a long one with some words in it, okay? You need to ad lib for me or whatever. For many years, I suffered from acne, which I was prescribed, and it's the one that begins with ERY.
Erythromycin.
That's it. Which held the problem largely in check, but was still fairly frequent outbursts. I'm 76 years old and have suffered from acne since my early teens. Well, on prescribed statins some 6 or 7 years ago, the accompanying leaflet advised not to take the drug at the same time as the statin, so I stopped. Within a short time, I noticed that I was no longer having the usual pustules and have not had any since. I'm not aware of this being researched and would like to know how to find a source who would be interested in exploring this issue. So I suppose that's two things. Do you think that they are combined, or is it just luck?
So originally was an erythromycin, which seemed to work, was put on a statin, therefore couldn't take the erythromycin because they interact with each other, which we know. And then what happened?
And then the usual pustules that she'd had have just disappeared.
So I guess the question is, was this acne? was this folliculitis? Because often the two look similar. They're a similar process, but are different. So on the body, most people will end up getting something called folliculitis, which is inflammation of the hair follicles, slightly different to acne, which is a combination of a few different things. So maybe the erythromycin just treated the folliculitis, which is now gone. And that's it. You've cleared the folliculitis, and maybe it never was acne to start with.
I suppose it's quite hard when it's gone. You can't tell what it was anyway to start with. But it's interesting that the person who says they're 76, I think people don't realise that, you know, for lots of people, acne just carries on in various guises, doesn't it?
Yes, we do see that. It's not that common, but yeah, we do see acne continuing lifelong for some people, and we often end up treating them lifelong as well.
I thought I had acne scar. Oh, this is a pigmentation one. I thought I had acne scarring on my neck, but now think it's pigment damage from perfume. Can anything be done about this?
Okay, so pigment damage from perfume. Now, pigmentation on the neck associated with perfume use is generally also associated with the interaction of the sun, UV radiation, with the perfume. So that's how it tends to form around the neck. And one way you can tell whether it is generally that is, if you look just under this area, it tends to be a lot clearer because you don't get much sun there. So your pigmentation tends to be around this area of the neck, this area of the neck, this sort of portion here tends to be clear. So if you've got clearance around here, you've got pigmentation on these sides, then you may have a condition called poikiloderma of Savat. Poikiloderma of Savat is a condition whereby you get pigmentation, which is a combination of long-term perfume use and sun exposure. Can you do anything about it? It's difficult, but yes, there are topical treatments that you can use that may help reduce pigmentation. You may want to use something like azelaic acid. You may want to use something like hydroquinone. There are some over-the-counter products like vitamin C, arbutin. These topical products can also sometimes help with pigmentation in the skin. So you might want to start off with the over-the-counter products, a retinol and maybe vitamin C. Start off with the combination, see if that works. And if it does, keep going. If it doesn't, see your GP or dermatologist for some more prescriptive treatments.
And I mean, I'd never heard of that before, but it was actually mentioned by, we had another on our webinars, one of the experts mentioned it, and that was the first time I'd ever heard about it. I mean, is it common? I mean,
yes.
Everybody gets. So why?
Not everybody, but it is a common thing we see, and a lot of the time people just don't make much of it, or they don't seek attention because it doesn't really bother them.
Yeah, but I was going to say, why don't the perfume people say something about it? But I suppose they're not going to, are they?
So fragrances are well known to cause allergies, and you know, we still have lots of fragrances. So, and if they do cause an irritation with sun exposure, that is not that uncommon. We see that quite a bit.
And it's purely because of the sun, the interaction with the sun. That
usually, yes, it's not. It tends not to be directly the perfumes unless you are truly allergic to that perfume. It tends to be long-term perfume use, sun exposure, combination of the two.
Right. Okay.
So it's better to put the perfume on your clothes rather than spraying it on your neck.
Yeah. Yeah. The other thing that I found it's really strange is some perfumes, if it gets onto my hair, it really smells revolting when it's on my hair, but other perfumes are fine on my hair. Why would that be?
I don't know. Maybe it's something to do with the oil mixing with some of the perfume, and maybe an ingredient thereby causing that.
Yeah, strange. I mean, I know they do perfume for hairs, don't they, as well?
Yeah.
Joe Malone does. Not that I'm plugging Joe Malone, but the same. I had bad acne as a child and concerned that my children might also go through this. Firstly, is it hereditary? And secondly, is there anything I can do to help them prevent from getting acne?
Okay, so yes, there is a genetic predisposition to acne. So if one or both parents have had severe acne, there is a higher chance that your children will also have acne. I guess unfortunately, there's not much you can do to prevent it. We know there are certain triggers to acne. So, for example, stress might make acne worse. It will not bring it on. Certain diets might make it worse. So, diets high in sugars may potentially make acne worse. But again, these are things that you might be able to control, and they may reduce the severity of acne, but they won't necessarily prevent it from coming on. The best thing you can do is, so when I see patients with severe acne or a teenager, I tend to always ask their parents, have you had severe acne? And I look at the skin of the parents as well, because if the parent has scarring, there's a chance that their kid will also have scarring. So I often will put treatments, start treatments at a higher level earlier on in these cases, rather than mess around with topicals, antibiotics. I might just put them directly on Roaccutane, because I can almost foresee what may happen to their skin if we leave it too long. So the best advice is that one is they may well get it. Unfortunately, there's not much you can do about it, except that if they do get acne, then see a dermatologist quicker rather than waiting around.
And Roaccutane, it's all about the sooner you get it, the less likely you're going to have scarring because it's gone sooner. Is that sort of right?
So you're trying to prevent the scarring from forming in the first place. Once you've got scarring, you've got it. So the idea of Roaccutane is you are preventing the large spots and preventing them from forming or turning into acne. Give me 1 second. Sorry, I'm just going to get the door. Give me apologies.
Okay.
Apologies for that.
I think the other day I had the telephone went off, the doorbell went off, my mobile went off. It was just horrendous.
So I'm in my minor ops room at the moment. I just finished operating, and one of the nurses left their ID card, so they can't do anything without it. So I had to let her in.
Oh, that's allowed then. Right. So what we were talking about, the Roaccutane, weren't we?
Yes, scarring. So we were saying that the idea of Roaccutane is to prevent scarring in the first place, because if you develop scars, you've got them.
Okay, cool. Not cool. I have just, next one. I've just turned 49 and started getting spots. First, it was just the odd 1 or 2. I never had spots when I was a teenager, but now I seem to always have a few with redness of the skin. Also, I presume I'm perimenopause.
How old was the patient?
49, so she may not have gone into full menopause.
Okay, so I guess the question is, do you have acne or do you have rosacea?
Yeah.
And it sounds like you may have rosacea. So if you've got a background redness with the occasional spot forming, that sounds more like rosacea than it does acne. So how do you tell the difference? Number one, you look at the patient. So generally, acne tends to be teenagers, generally, not always, and rosacea tends to be middle-aged Caucasian women. Generally, that's your a generalization, but that's what we tend to see in our clinics. Also, rosacea spots tend to be a little bit more tender. Skin tends to be more sensitive, and you will also find that there are specific triggers to what makes your rosacea worse. So the sun, for example, will make it worse, whereas with acne, the sun occasionally helps. Hot showers might make your skin red, might make the spots come on. You will also find that rosacea tends to be quite central facial, whereas acne might be sort of around the jawlines or up on the forehead, but rosacea tends to be more in this sort of area, around the nose, around the mid sort of cheeks. So the first step is, what do you have? Do you have rosacea or acne? And the treatments are different. So some of the treatments overlap, but there are also specific treatments that we use for rosacea. So I guess you need to see a dermatologist to get the right diagnosis. It may not be acne, and then you need the right treatments.
Rosacea, because we have a rosacea hub, and when I first started understanding about rosacea, because one always thinks, oh, it's somebody that's been drinking with a big nose, a bulbous nose or something like that. But I think it's one of the most undiagnosed skin conditions.
So rosacea, a lot of people have background rosacea, they don't realize it, and they may have just a little bit of redness, which gets worse in certain circumstances. And they often will just put that down to that's just their skin. But usually they may well have a background of rosacea. So if it's impacting your lifestyle, and if it's has some sort of impact, if you go red in situations when you don't want to go red, then maybe you should seek help. And there are treatments available for this. Rosacea can be tricky to diagnose if you're not seeing a specialist, because often, you're right, it is mixed with acne or confused with acne, and the treatments can be very different for the two. Sometimes it's also confused with eczema of the skin. And that can be a disaster then, because you end up getting steroids for eczema, which then just makes your rosacea worse.
It's very, very, very difficult, isn't it?
It is, yeah.
And I suppose, and that all goes down to the expertise of the dermatologist that you're seeing to hope that they hit the
and
right
usually
one.
it's just taking a good history, really, because rosacea, if you take a good, clear history, you should be able to diagnose rosacea just from the history alone, and then the clinical examination would also help.
Okay, that's good to know. In fact, we ought to do a webinar on rosacea, because I'm sure that would be super popular.
Yes, I think it would.
I'll pencil that one in then. I was wondering, what advice could you give to blackheads on nose and chin, and also advice on the best serums to use?
Okay, so I guess, all right, so blackheads, first of all. Blackheads are your pores that are essentially open, and it results from oxidization, which means the oxygen essentially getting to whatever's in the pores and causing them to become dark. So it's an open pore. A blackhead is an open pore. If it's a closed pore, it's a whitehead. Now, essentially, when you have blackheads, you tend to have increased amounts of oil production at the site, and you have a lot of debris that just collects and dead skin material within it. So you need to essentially exfoliate your skin, and you can use any really exfoliator on a regular basis, and that will help. But you also may need something to suppress the oil production, and you may need something to suppress any bacteria that might be there. So again, it's the same sort of things that you would use. You would use benzoyl peroxide for bacteria. You would use salicylic acid to help sort of strip the skin and also have some bacterial control. If you want something more potent, then something like tretinoin works really well. And you can buy over-the-counter retinols, and they come as different percentages. So you can get retinol over the counter. It comes as 0.1, 0.5, 1%, 2%. And they're very good. They're really good. They do work. But if you want something hard-hitting, then you see a dermatologist who can give you a prescription strength retinol, which is a tretinoin, which works a lot better, but can be a bit irritant, but most people will often get used to it. So the best treatments for blackheads are usually some sort of retinol or tretinoin-based product.
And is it possible, because you're saying about the pores, and you see some products where they say they make the pores smaller.
Yeah.
Can they do that?
So the size of your pores are genetically determined. Some people might, so pores are open. They have to be open because that's what a pore is. It's got to be open. In some people, they dilate too much, which is why when people say, I've got visible pores, what they mean is that they're actually a little bit more dilated than what they should be. And they may be dilated for a variety of reasons. So they may be dilated because you're producing lots of oil. So if you suppress that oil production, you might be able to tighten that pore slightly. It'll still be open, but you may be able to make it less dilated. Or if you have had a lot of sun exposure, then often what that does is it destroys a lot of the elastin, the collagen fibers in the skin, and they don't hold the pore tight, and it opens up. And that, unfortunately, isn't really reversible. But if you've got oil production related dilated pores, then you suppress the oil with something like a retinol or salicylic acid, or even niacinamide to some degree will do that. Then you might find that the pore size shrinks slightly and they just feel a bit tighter.
Right. And then presumably that's when we talk about elasticity of the skin. As you get older, you're losing that elasticity. So
naturally, with or without sun exposure, you are losing that elasticity. It's just, I think once you get beyond sort of mid-20s, your collagen production, etc., everything starts to drop anyway. So you start to lose all that elasticity, the collagen, the sort of building blocks of what keeps your skin firm and supple, and you start losing that. And added to that, long-term sun exposure will just make that a lot worse.
And this is just a private question. You know, you see collagen tablets advertised everywhere. Because then I've seen lots of things that they say that they don't really work. Will it add enough into your body to make a difference?
Okay, so my opinion on, so there's collagen drinks as well, there's collagen supplements, and there's topical collagen products as well. So my opinion on them is that there is nowhere near enough research to suggest they work. A lot of the studies that might suggest they work are often backed up by the company that is selling them. So a little bit biased. If I think about it, it doesn't make sense that it would work. If you are drinking a collagen supplement, I'm not sure how that is supposed to incorporate into your skin. You're drinking it, it'll go into your stomach, you'll probably end up peeing or pooing it out, basically. So I'm not sure how a collagen supplement that you are taking orally actually works its way into your dermis and epidermis. So it doesn't make sense to me. I won't say they don't work because there's still not enough research, but for the meantime, I can say that you're better off probably saving your money until there is good evidence that they actually do work.
Because when I've been to various beauty shows or whatever, looking from a work perspective, I can't believe how many drinks there are.
Yeah, and they're very expensive. They can cost hundreds of pounds.
Yeah,
absolutely.
Yeah, really
and there's not enough, there's not enough evidence to back up the fact they work. If you want to take them, fine. They're probably going to do no harm whatsoever, but they probably won't work either. And you're out of pocket hundreds of pounds.
But I suppose, as always, everybody's looking for some miracle cure to stop that aging process.
Yeah, absolutely.
I.e. me. So going back to, we've discussed her blackheads on nose and chin, and then she's saying the best serum. So I suppose, maybe, I don't know.
The question of what are you using your serums for? I guess anti-aging, moisturizing, anti-pigment. So there's lots of different serums for different for different conditions, and again, the evidence isn't all that strong on what you can buy over the counter. There is some evidence. Vitamin C, for example, vitamin C serums may well help with some degree of pigmentation. They may have some mild, they do have a photoprotective effect, so if used in combination with a sunscreen. So I think there is some weak evidence they work. And I think if you have the money and you want to purchase these, go ahead, fine. But if you see your dermatologist, they may be able to give you something prescription strength, which will work probably a lot better. But vitamin C serum, for example, will work good for pigmentation. There's lots of hyaluronic acid topically, which will work well for moisturizing your skin to a reasonable degree, but won't have an impact on long-term anti-aging, for example. Retinols, again, will have an impact on fine lines, and they do have an impact on preventing fine lines forming over the years, and they also have an impact on pigmentation. So I guess a retinol serum is worth it. Vitamin C serum, maybe. Hyaluronic acid, maybe. If you like, then go for it.
Retinol is the thing, isn't it?
Yes, yeah. I think it's the only thing that's really proven in research to work. So I think that's something that I do advocate. But you can, as I said, you can get prescription tretinoin from your dermatologist, where it will work a lot better than over-the-counter retinols. The only difference is that the prescription strength can be a little bit more irritant, but if you give them added treatments and explain how to use it, you can counteract that.
And is that something that a GP would? You could go to a GP? No.
GP won't be able to prescribe a tretinoin, and in fact, unfortunately, a lot of the times you won't be able to get it on the NHS either. So it would have to be a private dermatology prescription.
Not, obviously not that I'm asking for myself, thinking about getting my retinol. But I think probably lots of women, the good thing with retinol is that, because it's now so out there for people to have retinol, isn't it? And what I'm saying is good is because everything does say you start building up slowly, which, I don't think there's other treatments that you see that so much. And so because maybe there's more awareness, education awareness of these are long-term, but you do have to do it slowly to stop
Yes.
inflammation, etc.
Absolutely. We need to let your skin get used to the product. And ideally, anything you use, you want to be using it on a daily basis. So there's no point in doing a retinol twice a week. If it's really irritant and you can only do it twice a week, then it's pointless. Then you need to drop down your strength. You need to use something that you're doing daily, because you'll see more of a benefit in a lower strength product that you're using daily rather than in a higher strength that you're using twice a week.
Okay. Last question, and this is another one of those words. My 15-year-old son has been using Zineret. Yep. Face lotion for a few months now, and it has really helped his acne. How long should he be using it for? And is there any way to help clear the coloration marks left on his skin where he's had spots? So another pigmentation.
Yeah. So Zineret is erythromycin. Erythromycin is an antibiotic. You can get it as a tablet or a capsule as well. So Zineret is a topical antibiotic, and you can't use it permanently because it is an antibiotic. So our normal course tends to be 2 or 3 months, and then you stop it. And if you are getting recurrent acne, then you need to see your GP about the next step as to what else you can do. So other products, again, benzoyl peroxide, epiduo, adapalene, lots of other products, tretinoin, that can be used in place of the topical antibiotic, because at some point, if you continue it, you will develop a resistance to it and it just won't work. So ideally, you don't want to get to that point. You want to stop it and see your GP for the next steps. In terms of pigmentation, the best thing you can do is make sure you use a high factor sunscreen, because the sun and UV radiation will make that pigmentation a lot worse, and it will continue to drive the pigmentation. So you need to use a sunscreen whenever you're outdoors. Also use a sunscreen if you're sitting in front of a window or in a car, for example. So use sunscreen regularly. There have also been some studies that have actually looked at screen use and blue light and mobile phone usage, and whether the light from that has an impact on skin and pigmentation. And there are some studies suggesting that maybe when we have our phones close to us, and a lot of people use their phones at night in the dark when there's a lot of light coming directly to your face. So there may be something within that the amount of light is very low, but there may be a cumulative effect over years. So it's important to use sunscreen. So the question is, do you have to use it indoors at night as well? And we're not sure yet, but I mean, you should be using sunscreen if you're outdoors, definitely. So use sunscreen, regularly moisturize your skin. So there are lots of over-the-counter moisturizers. And I know there are products, newer products, for example, Thiamidol is a new product available on the market that is anti-pigment and has really good results in some studies. So you could use that. But just moisturizing and use a sun protection would probably be enough to clear your pigmentation, if it is, of course, pigmentation and not scarring.
And actually, that's the point. Is Roaccutane, is that, once again, that's not a GP? A GP can't.
Roaccutane?
Yeah, can a GP prescribe that? No, that, once again, it's a dermatologist.
Yes.
Right. Okay. When you have a repeat prescription, if you need one, do you have to get it from the dermatologist, or can the GP then carry on prescribing?
You have to see a dermatologist. In the UK, the current guidelines are that you have to see a dermatologist to get your Roaccutane prescription. So for women, they have to have a pregnancy test every month if you go on Roaccutane, which means that they have to see a dermatologist every month, because you can only get a month's supply. And for men, sometimes you can have a couple of months supply, but again, you'll have to see a dermatologist 6 to 8 weeks on a regular basis throughout your course, which may last up to 6 to 8 months.
Okay, brilliant. Well, that's it then. That's all the questions. I don't think we've got any questions below, but that was, I've now taken away some beauty advice, which is always anything that will help would be brilliant. But no, that's really, really helpful. Thank you so much, and really lovely to see you, Adil.
Thank you very much, and love to see you again.
And thank you to the British Skin Foundation. You must remember the British Skin Foundation, because they are brilliant. And Adil, I think you're coming back in a few months again, because we're doing one on skin cancer, which I think is hugely important, and it's hugely important for the preventative side, let alone recognising if you've got some dodgy freckles.
Yes, absolutely vital, really important, I think, webinar, that one. So I think I'd be happy to do that with you, hopefully in a couple of months, when it'll be probably the height of summer and a good time to be doing it, I think.
I think we've got it. I think it's in July. I think it's up already. So yeah, brilliant. So thank you, and thank you everyone for joining us. It was really interesting. Thank you.
Thank you so much.
Thanks.
Bye.
Bye.